Dr. Haynes just kind of gave a brief summary of everything I was going to talk about. Yeah, just speaking on free market ideas during residency interviews. This may not be applicable to quite a few people right now, but it'll just be something to keep in the back of your mind and be useful when you are interviewing. I just finished my interviews about 3 weeks ago, so I was on the interview trail for a good 2.5 months, and yeah, it was very successful in my opinion. But I wanted to do this because I was warned by a few different physicians, not any that were involved with BRI, but just other physicians I'd talked to, that mentioning free market ideas during residency interviews wasn't like the best idea, because a lot of programs are very academic centers with a lot of liberal policy or a lot of liberal ideas, and bringing up religion and politics is kind of a stigma, so just don't do it. However, because politics and free market ideas are a big passion of mine, I had to be true to myself, and these ideas were going to be bound to slip out in interviews anyway, so I might as well just talk about them up front. So I just wanted to share my experience with you guys about my interviews. So some advice that I have that Dr. Haynes talked about a little bit. The first one is don't bring up polarizing topics out of nowhere. If you guys are talking about good patient cases or patients that you saw during your interview, don't have a follow-up question. So what do you think about the Affordable Care Act? Or do you think it should be repealed, or we can go to single payer system? It's a very polarizing topic, and people don't generally just want to talk about that stuff right away. The next thing is unity. Arthur Brooks last year at the BRI conference brought up unity and finding a common ground between people that may have differing ideas. One way I was able to find this unity with people is talking about how free markets can help the poor. A perfect example of that is when I was working on a paper, I found direct primary care clinics that we kind of called charitable direct primary care clinics. And these clinics, they had benefactors, and they'd be paying a little bit higher membership rate, and then those benefactors would then be funding the whole clinic, and these doctors would then be able to see about 30 to 40% of their patients completely free. So you're bringing up these ideas with people, and you're talking more about the solutions that the free market can bring to healthcare, as opposed to a lot of the problems that healthcare currently has. And they really see you as the serious person that is very passionate about improving healthcare. So also, I interviewed at a lot of family med programs because I'm interested in going into direct primary care. But I mean, if you're going into surgery, things like the Surgery Center of Oklahoma is another great example, just a cash-based surgery center that's able to, save a lot of money for patients. Also, Milton Friedman said, when you talk about liberty, you have to smile. It's always great to have a smile on your face. If you go into an interview and you look angry, they think you're going to be aggressive, you come off, just kind of very cocky, they're not going to like you as much. So if you just have a smile on your face and you're talking about these ideas on the free market and whatnot, they're going to like you. Also, be respectful to the people you're interviewing with. I mean, that's kind of common sense, but when you're talking about these ideas, if you respect the other person's opinion, then you shouldn't really have any issues. Most importantly, just be yourself. You're on an interview, they want to get to know you. You really want to get to know the program, and if you're not yourself, it just makes it difficult for everyone. So on your ARIS applications, in your hobbies and interests, mention what you're interested in. If you're interested in direct primary care, if you're interested in Austrian economics, mention those things. If you mention it in your ARIS CV, it gives residents and faculty the opportunity to bring that topic up instead of you. I was mentioning you don't want to bring these topics up first. Let them bring it up before you. So I had a fourth-year resident come and talk to me in a pre-interview dinner, and he was like, "So I saw you're interested in Austrian economics. Can you kind of explain what that is?" And I didn't realize there were different fields. And so I explained Austrian economics, comparing it to Keynesian economics, and it was really interesting, and I didn't really think he was getting it, and he was playing dumb the whole time. He was like, "I minored in economics, so I know I'm very familiar with a lot of this stuff," and I mean, it was just a great talking point. The same thing happened in one of my interviews as well. I walk into the room, and the first question the physician asked me is, "So I've only seen 2 people that said they've been interested in Austrian economics. how do you know about this? Like, how familiar are you with it? And he was like, I was a private practice physician for quite some time. You know, I'm very much on that that slant of the free market, and I've been involved with the Mises Institute a little bit. So I mean, that's a great connection right there that I would have never been able to make had I not just included Austrian economics on my interest. Also, publications and presentations. This is another opportunity for interviewers to bring up what you're interested in. It shows your interviewer that it's something you're very passionate about. You know, I did a presentation last year for BRI on economics and healthcare policy, and I think that was kind of brought up a lot during interviews as well, and just shows I'm passionate about it. And publications. I had a couple blog posts for BRI. And BRI really wants to help you with the publications. It's a great way to get donors interested, and it's just another way to show you're passionate about free market ideas. So I really encourage you guys to do that. Also, volunteer and research / work experience. BRI got brought up all the time. Like, can you tell me your role with BRI? Who is BRI? What are they? And it's just, you know, it's something that I've been talking about the past 3 years, so it just comes natural to me now, and it's just really easy conversation. So personal statement as well. I mentioned in my personal statement just the importance of the doctor-patient relationship, and then being a leader in medicine. And then I had a lot of what I was talking about in my personal statement backed up in my CV. And I had one faculty interviewer just kind of going through my personal statement, and he was like, you know, I'm really loving this. He mentioned that he was a private practice physician as well. And he overheard me talking about Ron Paul in one of my other side interviews, and so he brought that up. He was really excited about that, and you know, he was like, "This is honestly one of the best personal statements I've ever read." He was like, "I think you're probably 10 to 15 years ahead of your colleagues right now," and you know, I thought that was really neat. But we talked the rest of the interview, probably about 25 minutes, just on healthcare policy, and knowing that we were able to bond like that for 30 minutes. He, you know, is definitely going to be an advocate when it comes to ranking you in the match. So I thought that was really neat. So these are some questions that I got pretty regularly. Where do you see yourself in 10 years? I'm interested in direct primary care, so when I got this question, I kind of smirked, and I was like, well, I mean, I've been interested in direct primary care for a while now. I would love to see myself in 10 years doing direct primary care, and if they were familiar with it, you know, I wouldn't need to elaborate on it much more, but otherwise, I'd be happy to talk about direct primary care, you know, what it's all about, how I would achieve that, and they really wanted to see that you were goal-oriented, and it was easy to show that in my direct primary care answer. Also, how does being involved in healthcare policy benefit your patients? I got this question a couple times, and it was kind of what we talked about yesterday. If physicians aren't involved in healthcare policy, it leaves the politicians making all the policies in healthcare, and I don't think that's what the doctors or the patients want to see. Because they're not the ones that are, you know, in those doctor-patient relationships. They don't know how we should be caring for patients, what patients actually need. So if we can get physicians more involved, it helps the patients in the long run. When I would bring up a direct primary care, they'd be like, oh, you mean concierge medicine? And so then I would have to differentiate between DPC and concierge, and because there's that kind of stigma if they think it's concierge medicine, that it's only for the wealthy people. And so you just kind of have to elaborate that it's not just for wealthy people that you're doing this for. There was a question I brought up yesterday with Dr. Gunther that I had a hard time answering sometimes, but it was just, if I would go into DPC, like how would a DPC surge exacerbate the doctor shortage? And so I loved her answers that she gave yesterday. And then there were a lot of questions, the behavioral questions, you know, tell me about a time when you had to, you know, you had a tough situation with a patient, or when you had to put together a big meeting or event. And so I was able to use a lot of BRI events that I had put together, particularly the debate, which I thought was a great event. So what are programs looking for? The ACGME family medicine criteria. Programs must assess residents on patient care, procedural skills, medical knowledge, practice-based learning, communication skills, and professionalism. If you made the interview normally, they wouldn't have a question about your medical knowledge, and they know they'd be confident that you'd you'd be good at procedures, or you'd be able to learn them at least. So the biggest things that programs are looking for during interviews are your professionalism with the staff, and then just communicating with the interviewers and the residents. And then also if you'll be a good fit for the program. And I had 2 program directors tell me right up front, we like you a lot. Your professionalism is well above all the other medical, or a lot of the applicants we've seen before. And so that was really encouraging to me. One of those program directors is someone that I had been working with in the ISMA. So it was a great connection that I met working in the ISMA, and it was good to hear that. So my conclusion is, don't be afraid to talk about free market ideas. I think it helps you probably more than it hurts you, because it lets those interviewers know that you're serious. You've put a lot of thought into these ideas, and you're looking forward to the future and being able to carry out some of these solutions. And also, direct primary care is supported by the AAFP, so most program directors are at least familiar with what direct primary care is, and that's really all I got. Thank you for your time.